taxes and simply reshuffles the formula. I think that if we do this, the end result will be we're going to have a food fight over the formula every time one party takes over. I don't think there's an end scenario where we finally get to any kind of stability in our country. I also think that this is not the promise we made. I made a promise to repeal Obamacare. I went to rally after rally after rally. I never had one person come up to me and said, oh, what you mean by repeal is that you're going to keep most of the spending and that you're going to block grant it to states, right? Nobody said that. This is not repeal. This is not what we promised. I have, however, said to the president over the weekend and to the vice president that I think we should do something. And the compromise to me is not getting everything I want. I want a complete repeal of Obamacare. I'm not going to get that. But am I willing to compromise? Yes. There are parts of this bill I like. I like the expansion of health savings accounts. I like the waivers for governors. And I think we have to cap entitlement spending because we're broke. So if they put those three things together in a bill, I'm for it. I also continue to pursue an alternative to Graham-Cassidy. I believe my alternative works better and it costs $0 federal dollars. My alternative is to let people come together in a group, let individuals come together in a group, buy insurance across state lines, and buy group health association insurance. The president, I've talked to him multiple times on this. I've talked to the Secretary of Labor. They've assured me they can do this by executive action, by reinterpreting existing statutes. We don't need Congress. So if you do those four things, I think you do a lot. I don't think we should give up. Health savings accounts, governor's waivers, put some caps on entitlements that Republicans can agree to, and then let people buy insurance across state lines through health associations. Those four things would significantly alter the equation of what we have now and would be a big help. They would be less partisan. I've yet to find a Democrat, not one Democrat in the Senate has come up to me and said, we absolutely are against health associations. Most of them are actually open-minded to letting people buy across state lines through a health association. With that, we'll take some questions.
Could you vote for any bill that still has block grants in it?
Well, I think I've offered the compromise that I think would be the best compromise. Let's narrow the focus of the bill to something we can all agree to. To my mind, the compromise does not include block grants.
Senator, what happens if the Republicans fail to pass this bill by October 1st? What happens then?
Obamacare continues to implode. Obamacare is a disaster. The individual market, we have insurance companies fleeing. But really, the blame should attach to those who voted for Obamacare. It doesn't work. It's a disaster to the individual market. It's extraordinarily expensive. And I think it's going to die a grisly death over the next 6 months to a year if we don't do anything. And there's a question. You either bail it out, and some Republicans want to bail it out with more subsidy money. I want to replace it with choice. Freedom of choice to buy what you want, when you want, from whomever you want.
If you don't repeal it this Congress, how can you repeal it later if the Democrats win the Senate? Because you will be blamed.
Every year there's a budget reconciliation. So if you're only going to do it with Republican votes, you can do it every year. You're going to have at least one shot through budget reconciliation. There are things you can do in a bipartisan way. One of the things that I think we could do in a bipartisan way are health associations, letting people buy insurance across state lines. Like I say, I think there is a compromise that can be achieved even with Democrats on that.
What did the president say to you? You told him you weren't going to support Graham-Cassidy. What did the president say to you?
Oh, on supporting it?
Senator, could you look at the cameras?
The question is basically what the president say about supporting Graham-Cassidy.
When you told him you weren't going to support Graham-Cassidy, what was his response?
You know, we had a friendly conversation. We always have friendly conversations. I've never had a cross word with the president. And as far as I can tell, he wasn't cross with me. I told him that I would consider voting for a narrow bill, and that's sort of where we left it. And I talked with the Vice President some, and I also talked with the Secretary of Health and Human Services, Secretary Price, as well.
Senator, what did you make of the updated formula that came out today with more money for Kentucky and for states with other senators who may or may not vote for this bill?
Unseemly. I think that if you're going to say that the whole country is short of money, which we are, and that we have to reform Medicaid, which we do, everybody should get the same thing. Why in the world would anybody think equal protection under the law is that one state doesn't get capped for Medicaid and everybody else would? So it doesn't seem right.
Well, there is a pressure from your constituents back home to vote for this bill?
No, in fact, I get the opposite. You know, I visit Republicans every time I'm home, and the response I'm getting from them is they want someone to stand strong on the deficit and how much debt our country's incurring. The deficit is largely driven by entitlements. If we vote for Graham-Cassidy, Republicans will now have their imprimatur on $1 trillion worth of spending. They say, oh no, it's already the Obamacare spending, we're just reshuffling it. No, I think if you vote for this bill, you put your stamp of approval on $1 trillion worth of Obamacare spending, which we just frankly don't have. Now they'll say, oh, it's better against the baseline of this. Nobody at home believes any of this baseline stuff. They believe more or less. We're going to spend more money next year or less. And overall, we keep spending more money every year. The deficit keeps rising.
Let's see some questions on this side.
If Graham-Cassidy does not pass, do you support dedicating the next budget resolution to tax reform, or would you want to see healthcare tax changes implemented in the next budget resolution?
I guess there's no reason why you couldn't do more than one thing in a budget resolution. You couldn't do taxes and healthcare at the same time. The rules get very technical and arcane as to whether or not they'll allow more than one issue to be in a bill. But I think there's no reason why you couldn't address at least some of the issues in the tax bill as well. But the thing is this is thrown together sort of in a slipshod way. Who would say we're going to vote on $1 trillion worth of grants without even the CBO looking at it or anybody else, and we're not going to have open hearings? We have people on the left saying it costs some states $2 billion, and then on the other side saying, oh no, your state gains $500 million. So what's the truth of this? The way we get the truth is you ask questions, we ask questions, everybody reads the bills, and we try to get to some truth. And I think the truth is still a little bit murky and uncertain as to what this bill does or doesn't do.
So you said that you would compromise on 4 points. Has the administration talked to you and said that they would be flexible on these 4 points that you just agreed?
I just wanted to let them know how accommodating I was and that I was willing to vote for quite a, I think there's, if you count 4 or 5 aspects of the bill, I'm for like 4 out of 5. I'm just not for a $1 trillion grant program that keeps most of the Obamacare spending. I also don't believe that health care is easily fixable. I think it's terribly broken. It was broken before Obamacare. I think Obamacare made it worse. And just because you say it's going to the states doesn't automatically make it better. In general, are decisions better at the state level? Yes, but it's not a guarantee that you're going to fix health care even at the state level. It is horribly broken. And I predict that if you do this, when the 2018 election rolls around, and see, a lot of this is about electoral politics. Republicans believe they're going to be punished if they don't do something. It's like a friend of mine, Thomas Massey, said in the House, it's like a kidney stone. Pass it, pass it, pass it. You just got to pass it. But it really should be about whether it's going to work. I have a strong feeling that in 2018, everything's still going to be in disarray, even if you pass this. And that disarray, who will be blamed for it? The people who now own health care, which are the Republicans. I think it's actually better to continue to monitor the downward death spiral of Obamacare and try to see if finally we'll get enough Republicans with enough courage to do what they promised. Republicans did not promise to block grant Obamacare. Republicans promised to repeal it. Maybe we can get a little bit more stiffer spines as they see Obamacare unravel.
Senator Paul, since you kind of came out against Graham-Cassidy, you've heard Senator Cruz and Senator Lee express hesitations about it. What have your conversations been like with them? And have you talked to them about, have the conversations been about getting on board with your plan to push forward with that?
You know, I think a lot of conservatives, both in the Senate and Congress, do support the buying across state lines of these issues and health plans. On the specifics of Graham-Cassidy, you have to ask them what they're for and against, but I've definitely voiced my opinion to both the caucus and everybody who will listen that I just don't think this is repeal.
Senator Paul, the president has said that you would be the Republican who saved Obamacare if you voted against this. Are you prepared to wear that moniker?
You know, the thing is that I don't think there's been a louder, more outspoken opponent of Obamacare in the country. And I feel confident that voters can make an informed decision over who's for and who's against. Now, I think some might say, oh, you're trying to be too pure and you don't get your way. But actually, I've already voted for several compromises. The 2015 repeal that I forced them to vote on again the last time, that is a compromise. That wasn't a complete repeal either. The skinny repeal, that wasn't a complete repeal either. I voted for several compromises. The main reason I can't vote for Graham-Cassidy is that I believe that it represents Republicans accepting $1 trillion worth of Obamacare spending. And people have different opinions on that. That is my opinion, that we accept $1 trillion, we reshuffle it, we take it from Democrat states to Republican states, and I don't think we really fix the problem.
We gotta go, thank you.
All right, thanks everybody. Thank you.